Okay, again, I'm going to encourage washing my hands. You can never be too clean. And I'm just going to set my supplies that I don't need quite yet just off to the side. I'm going to prime my tubing first. And go ahead and open my tubing bag. We're going to set this aside because it has our drop rate on it. And we've already checked our solution bags. So we're going to go ahead and open that. And with that, let me set that aside. We're going to want to fill out and mark this solution bag with the patient's name and date. And I'm going to just grab a pen real quick. So we put the patient's name on it and the room number, the date, and our initials. And then we also want to put on the bag what we have put into the bag, if we've added anything into the bag. We're going to put the infusion rate on here, the time we began it, and the time we expect it to be completed as well. So we're going to go ahead and put this on our bag, and we want to make sure not to cover up any of the information that's on the solution bag, so that nurses that take these patients after our shift has ended can see what type of solution that we used. So I'm going to go ahead and put it on the back, and we'll want to stick this onto an IV pole. And since I am at home and I don't have an IV pole, we're gonna sorry, my dog's barking. We're gonna set it on my chair just like that, and it's gonna stay. Sorry about my dog's barking. So I'm gonna go ahead and take the stuff off. I want to make sure that my tubing is all clamped so that my fluid doesn't start running into it before I'm ready. All right, we're gonna take this little blue thing off. And I'm gonna go ahead and spike my bag, and I'm just gonna move this so you can see this better. Spike my bag with my IV tubing. All right, and so we want to prime this little cylinder here, and you do that by just squeezing. You want it to about half full, so I'll have to squeeze it about twice. And then we can go ahead and we will start to fill the tubing. Sorry, I find it easier to kind of stretch it out beforehand. And I can unclamp it and slowly undo the roller clamp. And again, it's important that you do it slowly so that you eliminate any air bubbles as possible. Now I have my fluid running. And I'm just watching it go through, making sure that I tip it around where the connectors are so that we don't get air bubbles. All right, almost done. Okay, so I have my tubing primed. If I did, I don't have any air bubbles, but if I did have an air bubble, especially if it was close to the end, I could continue to run the fluid till, sorry that my dogs are making noise, till the air bubbles were out. And since I don't have an IV pole, I'm just going to hang this up here so it's not on the floor. And I will go ahead and make sure that it's clamped before bringing it into the patient's room. All right, so going in to the patient's room, of course, we want to check our patient with 2 identifications, ask them for their name and date of birth. We want to wash our hands and apply gloves. We want to start off by looking for a vein that we could use, and we want to start in the most distal part of the hand or the arm as we can, so that if we blow the veins, we can then go further up and not ruin it. We want to apply the tourniquet onto the patient's arm, and you want it about 4 to 8 inches from where you're going to put in the patient's IV. After applying it, we want to make sure that we check the radial pulse. If we can't feel the pulse, it's too tight, and we want to loosen this tourniquet up. Okay, so we'll go ahead and we'll feel for a vein, and you'll kind of, you can kind of pat it, or if you can't get it to come up, you want to make the patient create a fist, open and closing. And then we want to, if we still can't get it, we can apply a warm pack, might help, or tapping lightly. If the patient is hairy, we would want to trim the hair, shave the hair off to make sure that our stuff sticks and it doesn't fall off. After finding the IV, we want to undo the tourniquet and get our supplies ready. So again, checking our gauge of our needle, make sure that we have the right needle. We're just going to leave that there for a second. And we'll need a little thing of gauze, a saline flush, and a saline lock. And to help this stay sterile, we're going to keep it in this packaging, but we're going to go ahead and take off this blue thing, and I'm not going to take off the blue thing yet. Sorry. I'm going to flip it around. I didn't take off the blue thing yet. I'm going to go ahead and apply my flush to my saline lock. And like I said, I want to keep this as sterile as I can, so I'm going to keep this in the wrapper. I didn't take off that little blue piece. I want alcohol swab or pads. I'm just going to go ahead and open those. And then a Tegaderm or see-through cover to put on our dressing, and a piece of tape. And again, I could gather all this stuff and then make sure I wash my hands and put on clean gloves again, and just making sure that I'm clear. I'm going to put my piece of tape on the side right there. So then I'm going to grab my IV. I'm going to put my tourniquet back on. I'm going to make sure that this whole time I'm having good body mechanics, make sure that the bed is raised so I'm not hunching over, or the patient's in a comfortable position with his hand, and I am too in a comfortable position, and neither one of us are bending or twisting in an uncomfortable position. And I'm going to apply my tourniquet again and take my needle, and we're going to take that, and we want to hold it by the hub, and I'm just going to loosen this up a little bit. Hold it by the hub of the, hold up. I'm actually going to alcohol swab it first. So I'm going to do the IV right here. I'm going to go in a circular motion. Okay. And then I'm going to hold my IV, I didn't drop that, my IV by the hub of it. And I'm going to hold his hand, or with my non-dominant hand, I'm going to take my thumb, I'm going to hold his hand. I'm going to pull down on this vein so that it doesn't move. And I'm going to go in a 30 to 40 degree angle with the whole part of the needle up. And I'm going to go in until I get flashback. And then I'm going to stop, and I can put this down, even with the skin. And I can go ahead and insert just the catheter, not the needle. Alright, I'm going to pull that back and let it lock. And I'm going to go ahead and hold this and let the tourniquet out, putting pressure on this. And we're going to pull this. We're going to first take this out and take our blue thing off, and then pull the needle off. And we'd put this in our sharps container and twist our saline flush on and go ahead and flush our IV, making sure that it flows. And we want to flush about 5 milliliters in, and there shouldn't be any resistance or pressure. It should just go in smoothly. Alright, so we got 5 milliliters in, and we're going to go ahead and secure our IV. We're going to take a piece of tape. We're going to go to the IV hub. Ooh. And we're going to twist it around like this. Alright. And then we're going to put our little see-through cover on. And we want to make sure that we date it and initial it and write the gauge that we put on or in the patient. And we want to make sure that we put this on and not cover the saline lock. So we're just covering the IV head. Okay. All right, and so we can go ahead and take our flush off, and we're going to put a little piece of gauze underneath the saline lock just to help it not dig into the skin. And we're going to put another little piece of tape and secure the saline lock down. All right, and we would want to make sure to get rid of all of our garbage and make sure everything was cleaned up. And we'll hook our patient up to the IV that we have gotten ready, and it's hanging on our lovely IV pole that is a chair. Okay. All right. So we're going to go ahead and put our IV on to our saline lock. All right, so then we're going to go ahead and we would figure out what we would want our infusion rate to be at, or our drops in here per minute to be at. It would all be based off the doctor's orders and the tubing, which our tubing is 10 drops per milliliter. So we would figure out milliliters per minute and then times that by our drops per milliliter, which again is 10. And so I would go ahead and unclap it to those drops, and it would slowly start to infuse on our patient, and we could secure the tubing so that it doesn't pull with a piece of tape. And that way our patient doesn't have troubles going to the bathroom. And then, of course, we would want to lower our bed back down, make sure that our patient's in a safe position before leaving him, asking him if he needs anything, and that he's comfortable. We want to make sure that, and I'd go ahead and take my gloves off and wash my hands, and we want to make sure that we chart where we put the IV in and what gauge of needle we have in the patient's hand, and what hand we put it in, and what we have, what medication we have infusing into our patient. All right, before going into the room, we would check our orders to make sure that we, know what time or what type of solution and sequence needs to be administered into our patient. We want to make sure that we know the accurate rate that it should be in or be going. So going into the patient room, we would check the solution, and our order shows that we want normal saline. It does say that we want 1,000 milliliters infused in 6 hours. I did not have 1,000 milliliter bag as due to practicing purposes, and so I do show a 5 milliliter, but we're pretending this is a 1,000 milliliter bag. And we want to make sure that our flow rate per hour is roughly 167 mils per hour. And our drop rate, we want to be 28 drops per minute roughly. And that, so we would check that on our little cylinder here. And we would adjust the rate by using our rolling clamp here. And we would count 7 drops in a quarter of a minute, which again would equal roughly 28 drops per minute. We would want to make sure that we are checking our solution and our tubing to make sure that there's nothing wrong with it and everything still looks good. We want to check our IV site. We want to make sure that it's not infiltrated in any way. There's no bleeding. There's no bleeding. There's no inflammation. It's not hurting them. If it's in a joint, we might want to use like a joint or an arm board to help them from bending that joint and filtrating our IV. We would want to, we could always flush our IV with a flush to make sure that it's still running. And we want to make sure that we educate our patients about taking care of the IV so they're not pulling on it and they're not itching at it. And they're taking the pull with them if they're going to the bathroom, or they're making sure that they ask for assistance if they're wanting to get changed, or if they need help with their gown. Of course, we did put a button-up gown on him, so he can, if his gown gets soiled, he can change it. And that it is. That is it. Sorry about my dogs making noise. Just a little elaboration in case the filtration or infiltration of the IV is anytime that the solution or our saline flush wouldn't go through and there's a blockage of some sort, or our IV can be dislodged. So I'm going to go ahead and start a IV on my patient. Before I go ahead and do this, I want to check my patient's 6 right. So I'll make sure I have the right patient, right medication, right dose, right time, right route, and then right documentation. I want to encourage and do a lot of hand hygiene. Make sure I provide privacy for my patient if they don't want their family in there, asking their family to leave, pulling the curtain, just to make sure that they're as comfortable as possible. I want to check my MAR to make sure that I have the right fluids, and I am making sure the fluids that I do give are given through the right IV, and checking my IV size to make sure that I am putting in the right size of IV in, because certain fluids need certain sizes, like blood needs at least a 19 gauge needle. And then I want to, of course, check my solution and make sure that my bag isn't already open. There's no little particles in the this first bag, and that my expiration date is still good. My bag does expire in January of 2018, so this would be expired. So I would actually want to make sure that this gets returned to the pharmacy and get a new bag that isn't expired. And I want to make sure that there's no discoloring in my solution. And I want to, when I go in there, I'm going to make sure that I use 2 patient identifications, ask them for their name and date of birth, and make sure that I raise the bed up so that it is at a good working level and I'm not hunching over or twisting or anything, and me and the patient are both comfortable while doing the IV. Another thing that would be good to check before inserting the IV and hooking our patient up would be to make sure that he's wearing a gown that has buttons down the side, as if his gown were to get soiled, we could just unbutton his sleeves so we do not have to stop his IV.